That's one of the commitments we make as a SOFA speaker. And I'm very privileged to tell you that I've been a member or a part of SOFA for the last 10 years. So I'm actually celebrating my 10th anniversary with them. I'd be remiss if I did not disclose that First Heartland Capital is my broker dealer. Since I am licensed, I need to tell you about them, that they are basically my compliance office, and they basically monitor anything that I do from a selling perspective and that type of thing. So I'm obligated to let you know kind of who they are. So without further ado, if you remember nothing about what I tell you tonight, please remember these 3 key points. And I'm telling you, these are 3 key points. Number 1, if you don't enroll in Medicare on time, you're going to pay a monthly penalty. And the bad news is that monthly penalty is not a 1-month deal. That is a forever deal. So if you do not sign up on time, you will be penalized for the rest of your life. So that's not good. So key point number 1, you want to enroll on time. Okay. Key point number 2, if you do not get the right private insurance to go with Medicare, you may pay too much in premiums or out-of-pocket costs. So the fact right there, if you did not know that there were private insurance companies interlocking with Medicare to provide 100% of the coverage you need in retirement, you do know that now. There are private companies involved that work with Medicare. Medicare does not cover everything. Let me just tell you, there's going to be a quiz at the end. So let me just tell you, there are 3, I'm teasing you. There are 3 areas specifically that private carriers get involved with Medicare. Prescription drugs, number 1, it's also known as Part D. That's a private carrier that gets involved there. Your supplemental policy, I'll go into what that is. That's number 2. And number 3 is something called Medicare Advantage or Part C. Those are the 3 areas where private insurance carriers get involved with Medicare. And then point 3, if you're not planning for higher healthcare costs in retirement, I think you're making a big mistake, because healthcare just continues to go up. And if you do not have an adequate budget set aside with some escalators throughout, and I'll talk more about that as we go on and what that budget should look like, please pay heed. You must set up that budget. Okay, so I have today's presentation broken into 3 parts. Part 1, we're going to talk about Medicare enrollment. What is Medicare? And yes, I'm going to start at the very basics. I want everybody to be together on kind of where we are, and then we're going to build upon it, okay? Who needs to enroll in Medicare and when? How do you enroll in Medicare? Very simply, how do you do it? So I want to cover that. In part 2, I will cover how this private insurance stuff integrates with Medicare, okay? How much does Medicare cost? What does it cover? Almost as importantly, what does Medicare not cover that you have to be prepared to take on? And then how do these private insurance networks fit in? And then part 3, I'm going to talk about healthcare costs more generally in retirement, and 2 reasons why those costs will be higher for point 3 that I made earlier. Well, one is inflation, and right now inflation is very low. Inflation has been much higher if you depending what periodical you read. Inflation is somewhere, I don't know, 2.5%, 2.8% or something. And then the other one is the increased need for services as you age. So if you have a hip go bad, you have a knee, an ankle, all of those are going to cause your healthcare costs to rise in retirement. And then this big bullet here, and I didn't used to have this as a separate bullet, but it's gotten to be such a confusing issue that I wanted to state it very clearly. Medicare does not cover long-term care. Everyone needs to know that. I've had clients come in, I've had new folks come in and says, well, I don't have to really worry about that. Medicare is going to cover me in long-term care. No, Medicare will only cover up to 100 days of care, and those 100 days are only covered if you require skilled care. Okay, you're directly under the supervision of a doctor. The minute that you go what they call custodial care, Medicare doesn't pay anymore. You're on your own. Okay, so that's a very important point, and that's why I wanted to kind of create a bullet all by itself. Okay, so let's jump into part one. Medicare enrollment. All right, so who pays for healthcare in the US? Well, before age 65, usually your employer pays. You have employer health insurance. Normally, you're covered on their plan. If your wife is not working, normally she's covered on your plan. Your kids are covered on your plan, etc. Or you might have retiree health insurance. Maybe you're retired from your company at age 62 and age 63, 4, and up to 5. You're on the retiree health plan. Maybe you're on COBRA. Okay. Maybe you're like myself. You have an individual health plan that you have for your small company in the market. But then after age 65, Medicare pays first, except with employer group plans that cover 20 or more people. That's called a special enrollee, and we're going to talk more about that. And then your other insurance pays second. So just about in every case, if you're a retiree and you turn 65, you have to sign up for Medicare. And then your retiree health benefits become the secondary payer. Now, I'll have people, and you are penalized if you don't. And people are like, well, why are they so strict about signing up at age 65 for the Medicare? And I just have to remind everyone, remember, this is insurance, okay? And insurance, one of the main principles of insurance is that everyone signs up. The healthy and the not healthy sign up. And because everyone signs up, it creates kind of an offset. So the premiums for healthy folks are helping offset the sick folks, and the sick folks are getting more, benefit based on the healthy folks paying in. So if only the sick people signed up, we wouldn't have a system. And that's why they make it a penalty that if your rationale is, well, I'm healthy, I don't need coverage, I'm not going to sign up. That's why they penalize you for not doing so. It's when the Obama program came out with the Obamacare, one of the problems in that first year is that the penalty wasn't stiff enough for people not to sign up. They said, well, you know what, heck, I'm not going to sign up, I don't need healthcare. And because of that, they missed out on that premium revenue, and that's why rates the following year were so much higher. But this is the basic tenet of insurance, is that healthy and sick people will all sign up together. Okay, so what does this mean to you? Well, unless you're covered by an employer group plan that covers 20 or more people, you must enroll in Medicare when you turn 65. Okay, so, well, what if you don't? Okay, well, you're going to pay late enrollment penalties for not doing so. Your healthcare expenses may not be covered. You may have a gap in coverage, in other words, and you're going to be limited in what private healthcare options you can choose. Not a good scenario in any one of those three. Okay, so what is Medicare? Well, it's the National Health Insurance Program for those over 65 years of age. It's administered by the Center for Medicare and Medicaid Services, or it's also called CMS, and you enroll through the Social Security website, www.ssa.gov. That's where you enroll. Who is eligible? Well, everyone over 65, so all US citizens, legal residents who've lived in the US for at least continuously for at least 5 years are also eligible. And some people who are under 65 are also eligible for Medicare if they've been on Social Security disability benefits. And I think you'd have to be on those disability benefits. I think it's 2 years. So that's kind of who's eligible. Now, this is another area of confusion for folks. So I'm going to spend a little bit on this chart. There are only 4 parts of Medicare, only 4. I've had people tell me there's just 2. I've had people tell me there's, correctly 4. There's 4 parts to Medicare, A, B, C, and D. Okay, so let's just look at each one individually. A has that big H, okay, that's hospital insurance. And you see down below there underneath, you see that I have provided by Medicare. You see that right there under just below it, provided by Medicare. And you see that line covers both Part A and Part B. And Part B is your medical, is your doctor coverage. Okay, so when you pay that 1.45% out of your paycheck, each paycheck, what you're paying for is your Part A and part of your Part B. That's what that's going to. Then you have to the right of the chart, Part C and D. And you see down below, it says provided by private insurer that contracts with Medicare. So there's two of your three. Now, what was the third? Just a little quiz. The third was your supplemental coverage. Okay, so here's Part C, Medicare Advantage, and Part D is prescription drug coverage. So Medicare Advantage, that's almost like a PPO HMO type thing where they pre-negotiate A and B, okay, the premium that is, and then usually it will have a prescription drug plan included in the program, okay? So how do you actually sign up for Medicare? So that's the four parts. There's only four parts. So how do you sign up? Well, there's only two ways to sign up for Medicare. You only have two options. And by the way, I pulled this right out of, and you see it down below, the source. It's actually called Medicare and You. And this book, this is actually Medicare and You 2021. Each year they come out with a new book. And the book is about yay thick. It's free. You can go onto the Social Security website and you can order your own and they'll deliver it to you. I stole this right from the book. Okay, so here's how you can sign up for Medicare. You have option 1 to the left and option 2 to the right. Let's go through option 1. So in option 1, you sign up for Part A and Part B, and then you pick a Part D, a prescription drug plan. Okay. Once you have that done, then you pick a supplemental plan or Medigap. You see, I have both terms referenced on the chart, Medigap or Medicare supplemental insurance. I use the terms interchangeably. So that's one way, one option, and that's also called Original Medicare. You see at the top of the page. So option 1 is Original Medicare. You sign up for A and B. You get a prescription drug plan, okay, with a private carrier, and you get a supplemental plan with a private carrier. Okay, that's Original Medicare option 1. Option 2, you can go and sign up for Medicare Advantage, which is also known as Part C. By the way, that is one of the problems. They call the same thing multiple terms, and I'm bringing those multiple terms in just so that you recognize, oh yeah, Part C and Medicare Advantage are the same thing. Okay, so I just don't want people to get lost in the vernacular. And I'm sorry, there's a lot of vernacular when it comes to Medicare, but I can't do anything about that. I have to make sure that you understand the language. Okay, so with option 2, we have this Medicare Advantage, also known as Part C. You get Part A, which is your hospital coverage. You get Part B, which is your doctor coverage. And then you shop for a prescription drug plan. Now, notice that you don't get a Medigap plan if you go after the Medicare Advantage option. The reason for that is that the 20% that is not paid by Part D with Original Medicare never comes up as an item in Part C, Medicare Advantage. And the reason for that is a function of how the doctor has agreed to be paid with Advantage. And here's what the doctor has agreed. If you have a Medicare Advantage program and that doctor accepts you into that program, that doctor is going to receive a payment every month, whether you show up or not. When you do show up because you have an ailment, they don't get paid anymore. So they've decided, and they've basically negotiated a fee that they are happy with, that they will take, and they will take no more. So the 20% never comes in. That's why there's no Medigap on that side. I've had that question asked several times. Hey, why don't I need to get a Medigap policy on the option 2 version, but I do need to get one in the option 1 version? That is why. Okay, so, and by the way, these are the only 2 ways to sign up for Medicare. You either decide to go with option 1, the Original Medicare route, or you decide to go with option 2, the Medicare Advantage Part C route. That's it. That's the only way you can sign up. Okay, so how do you enroll in Medicare? Well, like anything else, it's not a simple answer. So if you are, and you see I kind of have in red there, are receiving Social Security when you turn 65, Medicare Parts A and B are automatic. Now, could you be receiving Social Security at 65? Sure. You could start collecting Social Security at 62. Incidentally, I do another class on Social Security by itself because there's a whole litany of language there an opportunity to work on maximizing your benefit for you and your spouse if you desire to do that. And I don't know of anyone who doesn't want to get the most out of that system as possible. So please go to my website and see when I'm doing Social Security next. You'll get a lot of that program too. Okay, back to here. So if you are receiving Social Security when you turn 65, Medicare's Part A and B are automatic. You can decline if you don't want Part B. Now, why would you do that? Well, if you're 65, you could indeed still be working. And if you're still working and you're covered by your employer's plan, why would you want to pay the premium due on Part B on top of that? You're double paying. You don't need that. However, you might want to take Part A. Why? Well, Part A doesn't cost a premium, and Part A could supplement your hospitalization coverage that you have at work. Okay, so coverage starts the first day of the month that you turn 65. So if your birthday is June 7th, coverage would begin on June 1. Part C and D are not automatic. Just think about that. Why wouldn't C and D be automatic? Well, because they're private carriers. They're not part of a government plan called Social Security. They don't know anything about you, those private carriers. So for you to get your prescription drug coverage, which is D, or for you to go with option 2 and subscribe to an Advantage plan, you've got to take some type of proaction, okay? You have to take some action to go get those. Okay, so what if you're not receiving Social Security? Well, when you turn 65, you must sign up through the Social Security Administration website, okay? And when do you sign up? Well, you have 3 enrollment periods. Now, this is an area I'm going to spend some time on because this is where I get a lot of questions. There are three enrollment periods, and there are only 3 enrollment periods. This is it. So the initial enrollment period is if you're not covered by a group plan at age 65. The special enrollment period is if you are covered by a group plan at 65, that applies to you, that period. And then general enrollment, and that's if you missed either the initial or the special enrollment, okay? So let's go through them one at a time. So let's start with the initial. I think many people have heard about this 7-month window of signing up for Medicare, and that's kind of what you have to do. Well, that's true, but here's that 7-month window, and here's how it works. So let's just say, I'll continue with the June 7th example. Let's just say the month that you turn 65 is June. Okay, so this would say that you'd have to sign up in, let's see, June, so May, June, July, let's see, May, June, let's do 3 months. So April, May, I don't have my months. March, April, May, sorry. March, April, May, you'd sign up in March, April, or May, and then what would happen? So let's just say you sign up in April and your birthday is June. Well, your coverage would start on June 1. Now you see that little red that says delayed start. All that means is that that's part of the 7 months. So if you sign up, so let's just say you don't sign up in those no delay category. Let's just say you sign up July 15th. Well, what that delayed start means is that your coverage won't start until August 1. So if you sign up on July 15th, you're going to basically start the first day of the following month. That's what that means. So, and then who signs up in this initial enrollment period? This is really important. So this basically would be for Part A, who signs up during the initial enrollment period? Well, almost everyone who turns 65. Okay, you want to check with your benefits administrator if you're still working and covered by a large employer plan. And I'll just tell you a story here because it's very applicable. I live in Belmead, as Kevin had said. We live in Belmead, and we're in Montgomery Township. And a gentleman come to one of my classes on Medicare, and he says, I have to tell you something that happened to me. I am 65. My wife is working for the township. The township has well over 100 employees. And the person said he called the 800 number and he asked the Medicare folks, does he have to sign up? Now look at the scenario I just laid out. His wife is still working. He's covered on her plan. He's a consultant and he's turning 65. She's in a company of more than 20 people. Does he have to sign up? Well, guess what? The answer is no. Okay, that's the right answer. What was he told from the folks on the 800 number? Yeah, you have to sign up. I bring this up to you because There are 10,000 people turning 65 a day in the United States. The 800 number is a little busy. There are a lot of newbies on the line, okay, new employees. They're getting trained, okay, but if you hear something funky, okay, that's a technical term I use, that just is wrong. I mean, that person did not have to sign up. You need to ask for kind of it's called tier 2 support. You got to ask for a supervisor to get on the line and just check if you think you're getting information that's not accurate. That person was just told the wrong thing, okay? Now, on Part A, you may be advised to enroll in Medicare Part A to enhance hospitalization. That's what I talked about before. But here's the thing. If you're participating in an HSA, a health savings account, now that's an account that partners up with a high deductible health plan. If you have one of those type of accounts and you wish to continue to participate in that HSA, in other words, fund it, which I would recommend you do. They're very powerful. I love HSAs. Then do not sign up for Part A, because Medicare does not allow you to have an HSA and have Part A coverage. A lot of people don't know that. So please know that, all right? That's a big deal. There are penalties involved, by the way, if you continue to contribute to an HSA and you have Part A, okay? Just leaving it at that. I'm not the penalty police. I'm just educating you on how it works, okay? So who signs up for Part B? Well, people who are not covered by a comprehensive employer-sponsored group health plan that covers 20 or more employees. So that would be people who are not working, you're self-employed, big one, employed by a company of less than 20 employees. You're working in a law firm or an accounting firm or a doctor's office, and there's 10 of you. Do you need to sign up for Medicare when you turn 65? Yes, that's less than 20. You have to sign up for Medicare. There are a lot of attorneys out there that don't know that, and they're not going to advise you because they didn't know. Okay, and if that's not answered by, that's not an acceptable answer from Medicare. If you don't know, you're penalized. It's your job to know. Okay, so you're saying your ignorance of the law is not an excuse, in other words. Okay, if you're on COBRA, if you're receiving retiree benefits, so you're one of those folks fortunate enough to retire at age 63, here it is, you're turning 65, please make sure you sign up for Medicare, because Medicare becomes the primary payer and your retiree health benefits become the supplement. Very important. Or you're employed by a company whose health plan is less comprehensive than Medicare. Okay, so those are the folks that have to sign up for Part B. If you're not working, self-employed, etc. Okay, now, who signs up for Part D during the initial enrollment period? Well, people have signed up for Part A and Part B and want prescription drug coverage. Now, you must sign up when you're first eligible, or you face late enrollment penalties. I get this question all the time. Kevin, I'm not taking any prescription drugs, so I'm not going to sign up for a plan. Oh, okay, well, you can do that. But then when you're on your first prescription drug in 6 years and you go to sign up, guess what? You get to pay a penalty for the rest of your life because you didn't sign up when you were first eligible. I'm back to the basic tenets of how insurance works, everybody. That's how it works. What I recommend you would do, even if you're not ending meds, find the cheapest plan out there and at least pay the 12 or 13 bucks a month for the cheapest plan. That's what I'd recommend you do. Do not just, blow it off and say, I'm not any meds, I'm not signing up. I wouldn't do that. Medicare Part D will become very expensive for you in retirement. Don't do that. Okay, so 2 options for Part D. You can get a standalone prescription drug plan or a Medicare or a plan through Medicare Advantage, Part C. Okay, so that's the first enrollment period. That's the initial enrollment period. Now, the second enrollment period is called the special enrollment period. Now, that's for folks who turn 65 and they still want to work, and the company's large enough. So the company is 20 or more people. They wish to stay on payroll. They're still working, or their spouse is still working and they're covered under the spouse's plan. You're a special enrollee. You do not have to sign up for Medicare when you turn 65. Now, they're going to send you automatically, the Part A and Part B card because they know how old you are. I would, in the envelope, I would check the box, mail it back, and decline Part B because you have coverage. But that being said, let's go down the scenario and okay, now you turn 68 and you want to hang the spurs up. You now have, as a special enrollee, a sign-up period. Okay, but it's a special enrollee sign-up period. And what is that? Well, the special enrollment period for Part B is anytime before group coverage ends or within 8 months of when group coverage ends. And then Part D is anytime before group coverage ends or 63 days after coverage ends. Why are they not the same? I can't, beyond the scope of my class, I do not know why those are not the same. Why aren't they both 8 months or why aren't they both 63 days? I can't tell you, but those are the rules. Now, if you don't sign up 8 months for Part B as a special enrollee, guess what? You are considered late, and now you're going to get a late enrollment penalty for the rest of your life. Okay, so, and they're very serious about this. You got to make sure you do this correctly. Okay, very serious. So what I normally tell people is that, where are we? We're in February. So you're going to retire June 30. You're hanging it up. You're done. I would be calling Medicare, Social Security right now, and I'd be signing up for Medicare, and I would ask them, please make it effective on July 1, because group coverage is ending June 30. You want no gap in coverage. You want no gap, okay? And then what'll happen is that they'll mail you your Part A card, okay? Part A will have been effective the first day of the month you turn 65. Part B will be effective on, in my example, 7/1 of 2021, okay? Once you have the Medicare card with those two A and B effective, now you can go get a supplemental plan. Now you can go get a prescription drug plan. Okay, that's kind of how the dominoes fall. That's how you do it. Okay, so the best time to enroll in Medicare is either during the initial or special enrollment period to avoid any gaps. Now, there is a third enrollment period. Don't recommend this. I would imagine that you probably didn't come to my class if you're stuck in this one. But here's the third one. It's called the general enrollment period. And this is if you missed the first two. If you missed the initial enrollment, the general enrollment period runs between January 1 and March 31. And here's the deal. You can sign up January, February, March, but your coverage doesn't start until July 1. Yeah, that's a gap. So you have a health issue on April 10th, you're on your own. Yo-yo, you're paying out of pocket. So don't let this be you. This is the third enrollment period. So just a quick summary of the three periods. You have the initial, you have the special, and you have the general. The initial is if for those folks who are turning 65 and you're done, you're retired. You're not still working for a company or of 20 or more people, nor is your spouse, okay? You're in that 7-month window, go get it done. Special enrollment period, you turn 65, but you're still working, or your spouse is, and you're on their program. You turn 68, okay, now you want to hang it up. You're a special enrollee. Part B, you have to sign up within 8 months or before group coverage ends. Part D, you have to sign up within 63 days or before group coverage ends. And then you have general enrollment. If you miss those first two, the initial or the special, you are a general enrollee. You can sign up January, February, March, but your coverage isn't going to start until July 1. So those are the three enrollment periods. Which one is applicable to you depends on your work situation. What are you doing with work? Okay, so how do you sign up? Very easy. This is actually the website, www.ssa.gov. That is the radio button. Click apply for benefits. My clients tell me this takes all of about 12 minutes to do. Online is one way. You can call the 800 number. The centers are slowly opening again. You can make an appointment and go in. If you are not comfortable with either a phone call or doing it online, or you don't have a computer, whatever the case might be, you can certainly go in to an office. Again, I couldn't say that 7 months ago, all the offices were closed, but they're starting to open them now, and you can sign up. So how do you sign up for Medicare Part D? So this is very interesting. So first you decide whether you want the original Medicare, the left-hand side of the chart, or do you want Advantage, which is the right-hand side of the chart? If original, you want to stop for a standalone policy, and I mean that sincerely, shop, because private carriers have very, very different costs between one another. If you're enrolling in Advantage, you can also shop with a plan to see what's best for you. You apply for Part D through a private insurer or through Medicare at www.medicare.gov. Now, I'll tell you, that's an important website. So if you have your prescription drugs and you know what you're taking, the times per day you take it, and the dosage you're taking, and the pharmacy you like to go to, you can actually put that data into this software tool that they have on www.medicare.gov. And the system will come back and tell you what prescription drug plan is probably best for you. There are only 26 different plans in New Jersey. Yeah, so you can imagine, you know, it's difficult trying to figure out which is the right one. But the way you figure that out is not the cost of the premium per month. That is not the way you do it, unless you're on no meds, then pick the cheapest one. The way you figure out what plan is best is you go into this website and you load in your meds and you see how your meds are treated by that particular plan, okay? And that may not come out to be the plan that has the smallest premium cost per month. The premium cost may be a little bit bigger, but they cover more of your drugs, if you follow me. So that's how you really have to do that. Okay, so that's Part D. So let's move on to Part 2, because I do want to make sure that I'm keeping us to the hour. So Medicare and private insurance. So premiums and out-of-pocket costs for Medicare beneficiaries. Premiums are about $22.94, services about $31.66. You know, and kind of what do those out-of-pocket costs comprise of? Well, they're premiums. So Part B premiums are paid to Medicare. Private insurance premiums are paid to the private carriers, and that includes Part D and Medicare Advantage. Then you have deductibles and copays, et cetera. So more specifically, Part A, which is paid to Medicare, well, it's zero if self and spouse paid into the Social Security system for greater than or equal to 40 quarters. So that is where the Social Security system and the Medicare system kind of overlap. If you have 40 quarters of service in the Social Security system, which is roughly 10 years, and as long as each of those years you made, I think it's $1,160. So you would qualify to have your Part A for free. If you don't have 10 years of credited service through the Social Security system, you can still get Part A, but you're going to pay a premium for it. And that's what I've outlined there. And these are the 2021 rates. These go up every year. They go up by a factor of inflation, so they go up a little bit. And then you have Part B. Okay, that's paid to Medicare. Now that's $148.50 per month. That is the premium that you pay for that. Plus, there's an income-related adjustment that's if applicable. And this catches a lot of people off guard. That's also called the IRMA, the Income-Related Monthly Adjustment Amount, IRMAA. And this, again, it's a surcharge. Some people call it another tax. I do. It takes money out of your pocket. It's a tax, but it's a surcharge that if you make too much money, you actually have to pay more than the $148.50. That surcharge, that IRMA, applies to Part D as well. There is an income-related monthly adjustment there. So what are those limits? Well, that's broadly published. So, and here's the IRMA limit. So let's just pick on modified adjusted gross income joint. And let's just look at 176,222 to 222,000. So there's your $148 that you'd pay. And then the next column over is the IRMA for Part B. So that's another $59.40. And then let's just say you have a Part D plan that's $40 per month. You'd pay another $12.30 on that. So if you were in that category of Magi, you would pay $260.20 each instead of $188.50 each. And you know, a lot of people say, well, that's a lot of money. I said, well, let me just tell you something. If you're in the category where you are going to have a Social Security check and your wife will, and you've been blessed with a pension and your wife is also blessed with a pension, guess what? You're going to be in this category here of the 176. And the reason I say that is because you have 4 income checks coming in before you get to any kind of investable assets where you have to take a required minimum distribution at age 72. I see it all the time. This is something that's very common and it occurs a lot. And there are strategies that I like to employ here. And you could take me up on meeting and having a chat about this, but this is where Roth conversions can be very effective in helping keep away from the IRMA. But the IRMA is alive and well, so please be aware of it. All right, so deductibles.
Hey
This is the
there,
amount you pay.
Dad.
Yes.
We had a question come in just really briefly.
Oh, yes.
The question was, my COBRA ends in September 2021. Assuming I will need to get private insurance to cover October, November, and December, is it possible to get into an Advantage-like plan with a company that has Medicare Advantage?
When do you turn 65? I don't know if you want to answer that on the phone, but I don't have enough facts. When do you turn 65 during that COBRA period? COBRA lasts 18 months.
January, I'll be 65. I've been on it since March when COVID hit.
So March last year
Of 2020, yeah.
Yeah, so it's gonna run out on you in September. No, you're gonna have to find a private plan to carry you those 3 or 4 months till you hit 65. You're gonna have to find a private plan to do that, to bridge that gap for you. Yeah.
Okay. Thanks.
Okay. All right. So deductibles. By the way, I have someone. I could give you a call in the morning. I don't know. Your thing says Ocean's Edge Board. I'm sorry, we don't know your name, but I could call you. I could call you tomorrow. I could give you a person that could help with that private insurance. I don't do private health insurance, but I do have someone that I will very happily recommend. I personally use the lad for my company, so I think he's very good. Anyway, so I don't, but I'd be happy to tell you who that is. So okay, so Part A. So you have a deductible of $1,484, but catch my language here, per spell of illness. Well, how many illnesses could you have in a given year? Well, that's the point. You could have multiple. So, and then Part B is just, $203 per year. That's just 203, no spell of illness there. And then Part D, prescription drug, you have to pay $445 before the drug plan kicks in. So we jump over to coinsurance, the amount you pay. Now here's hospitalization. Now remember, I said hospitalization was free. Well, listen, it's free for the first 60 days. If you're in the hospital longer than that, you can pay a copay. You're going to pay $371 a day for days 61 to 90. Now, these may look like big numbers, but this is why you have a supplemental plan. Okay, the supplemental plan could cover your hospital insurance, your hospital coverage. Okay, Part B. So Part B, if you only sign up for Medicare and you get Part A and Part B, you have 80% of your Medicare, your medical coverage covered. 80%, no drugs, by the way, but 80%. Part B pays 80%, okay, of those doctor costs. That's why you want to have a supplemental plan. No one wants to be susceptible to that 20%. Nobody. If you have an issue with your heart, that cardiologist could cost $150,000, $200,000, and you would owe 20% of that if you don't have a supplemental plan to cover it. So traveling on here, we have Part D. You have a $445 deductible, and then 25% of the drug costs after deductible has been paid. Okay, that's what you'd have to pay. So the drug plan pays 75%. Once you reach an out-of-pocket amount of $6,550, they pay more. But let me just share with you again. Part D, private carrier. Premiums are all over the place. You want to make sure you shop here and make sure you get the carrier that is best for the medications that you're taking. Okay, it's very critical that you do that. And even I'll share this with you. So we just went through, October 15th to December 6th, December 7th. There's something called the open enrollment period. So now that's different. That's for folks who are on Medicare and wish to make a change. So just because you sign up for Medicare doesn't mean you have to stay on or stay with that carrier the rest of your life. That's where, you know, you want to look at every year your prescription drug plan, because here's the fact. You may have this and beyond the same drugs, but your formulary on how it's covered may change. The only way you're going to know that is to shop around and see if it has indeed changed, and that's rerunning the numbers for the new plan. So that's something that you want to make sure that you keep track of. Okay, what Medicare covers? Well, 100% again of the first 60 days, medical services, 80% of the cost, some preventive services. What doesn't it cover? Well, long-term care, I have to put that one first because that could be a real chink in the armor if you don't have long-term care. Incidentally, that's become such a hot topic that SOFA, we do a presentation on long-term care now to educate people on kind of what are the 4 ways that you could get long-term care and how does that look. Again, we don't talk about companies and products. We just educate people on these are the ways you could get this stuff. But long-term care, that's really become a popular program that we put on over the last 6 or 8 months. And interestingly enough, I can tell you why, because people have really in this COVID thing, and this is true, people have really taken inventory of their own mortality and morbidity. I know it sounds funky, but people have really done an evaluation as, geez, you know what? I don't think I have enough life insurance if something were to happen to me. Or, you know, what am I going to do if you go into a long-term care facility? Holy cow, that could be $80,000 a year. How are we going to do that? So more and more people have kind of thought about this, and consequently, last year, the 2 insurance programs that have had the greatest sales were life insurance and long-term care coverage. Interesting, right? People just kind of taking this inventory with this whole COVID craziness. I thought it was interesting, but maybe you don't. Care delivered outside the United States. I get that a lot. People, you know, want to go and do an expat thing for 5 months in Spain. Hey, does Medicare cover? No, it doesn't. What I'd recommend you do is get some type of program in country that would cover you for like a major issue. Okay. Certainly dental care is not covered. Vision, hearing aids, you can read the list. Okay, those are not covered. What private insurance may cover in part or in full. Okay, well, deductibles and coinsurance amounts, the Part A deductible, hospital costs after the 60 days, prescription drugs, the deductible maybe, certainly the 20% of doctor bills Medicare doesn't pay. And that's these Medigap policies. That's why I recommend you have to have a Medigap policy. You do not want to have yourself susceptible to that cost. And again, these are provided by private health insurance companies for individuals. They're sold by private carriers. It supplements original Medicare for Part A, Part B, and they follow state guidelines. So if you buy a Plan G in New Jersey, well, the Plan G in Delaware is going to cover all the same things. The difference between the 2 plans is what you pay for it. That's going to be the difference. But the plans are going to be covering exactly the same thing. In other words, they're standardized. Okay. Massachusetts, Minnesota, and Wisconsin, they have their own gig. I put that up there only because occasionally I get some people that have a sister-in-law in Massachusetts, and those are different plans. I don't cover them here on our program. I really focus on Jersey because that's where I am. Medigap, remember, I mentioned earlier, you can't get a Medigap plan with a Medicare Advantage program. Why? That 20% never comes up. The doctor gets almost like a little annuity every month. That's basically, he gets paid whether you show up or not. So he can't charge anymore. You pay obviously a monthly premium. And again, these costs on the Medigap plans, they vary. Why? Well, it's private carriers that are providing it. So here's kind of a snapshot of the Medigap plans that are out there. F has been discontinued effective January 1 of 2020, a year ago, January. So right now, the most comprehensive plan out there is a Plan G. And you see a bunch of 100% in there, except for the Part B deductible. Now remember, the Part B deductible is $203. So you're not talking about a lot of money. But Plan G is the most comprehensive. It's the one that I think are or most attractive. Let me put it that way. Let me also share this. When you first become eligible for Medicare, you are basically guaranteed insurable. In other words, it's a guaranteed issue. There is no medical underwriting. This is the first opportunity you have to get onto Medicare. They're going to accept the insurance carriers are going to accept you. But I've had people say, well, you know what? I don't need all that coverage that G gives. I'm going to go and sign up for Plan A. So obviously, if you look at Plan A's column and compare it to Plan G's column, guess whose column is going to be cheaper on a premium basis? Well, Plan A is. It doesn't cover as much. But here's the thing. If in 3 years, okay, so you save money on Plan A each month, okay, fine. In 3 years, you say, you know what? My health is not cooperating with me. I think I'm going to take Lynch's advice and I'm going to go over and get this Plan G. Well, guess what? If your health hasn't cooperated, you may not qualify because you're beyond your guaranteed issue period. You're no longer 65. Now you're 68. The carrier is going to can underwrite you and decline your application to get a Plan G. So just be aware of that. You're in a very unique situation where no matter what your health history has been, you must be taken. You must be taken into the program. I think you might want to get the one that has the most comprehensive coverage for you, even if you're going to pay a few shekels more, because if your health doesn't cooperate, you may not be able to get into that program later. I'm just saying, everyone makes their own decisions. You just got to be aware of the ramifications of the decision. So the Advantage plans, okay, health plan options are approved by Medicare. Again, it's also called Part C, run by private companies, so you know you can shop it. You know you can shop it. Medicare pays an amount for each member's care. You may have to use, let me talk about this, may have to use a network of doctors. So Medicare has Advantage plans, Part C. They've pre-negotiated the doctors and hospitals that you can use. I get this question all the time, you know, well, Kevin, which option is better? Should I sign up the original Medicare or should I go for the Medicare Advantage? And I'll tell you something, it really depends. My mom, when she was living, she was on an Advantage plan. And the biggest reason we're on it is her GP, her general practitioner was in the plan that she picked. But the bad thing about her plan is that the hospitalization cost was like $8,500 we'd have to pay out of pocket if mom went into the hospital, and then the plan would pick up. Now, you know, these Advantage plans, they might not have your primary care physician in the plan that you pick. And if your primary care physician, if that means a lot to you to have that person, well, then you may want to stick with original Medicare and not do an Advantage plan. Said another way, you might have a cancer situation later, and the plan you pick on an Advantage basis, well, maybe it doesn't include Memorial Sloan Kettering, and you want Memorial in the plan. Well, you can go, but now you're out of network. So, which is better? Unfortunately, I have to say it depends. You know, if you do the original route, the original Medicare, it's more defined. You kind of know what your costs are going to be. You certainly have the entire pick of who you want to use. If you use the Advantage plan, okay, it's a little more confined, okay, with who you can use, but the plans tend to be a little less expensive. So I can't answer which one is better. It really depends on your situation, but those are different things you might want to keep in mind. So shop carefully for this private insurance. And again, it appears in 3 areas. It's prescription drug coverage, supplemental coverage, okay, and then Part C or Medicare Advantage, okay. All right, so Part 3 coming down the pike here, coming to the end, planning for higher healthcare costs and retirement. Well, let's talk about that a little bit. Spending by gender and age, you know, as you age, you see the cost for, and that aqua line is or green, I guess, it's more services. You see that is going up as you age. You know, the typical budget, I said I'd go over this with you. Well, remember, I said Part B's premium was $148.50 a month. And then I'm putting in a Medigap premium. I'm using as a budget $200, and I'm using $40 for the drug plan. So that comes to $388 monthly. So if I then take that and multiply by 12, I come out with a number. if I add some out-of-pocket costs on drugs, I add some dental and vision out-of-pocket, alternative care out-of-pocket, you can easily get to $6,000, $6,300 per year per person, and you're not sick. Yeah. So if you're a couple listening to me, you need to budget $1,000 a month for medical costs. That's what you need to budget. And that's today, and it goes up. So we need to figure out, and kind of my call to action is, have you figured out where you're going to get the money to pay for healthcare benefits, where you have kind of a 2.5%, 3% COLA, cost of living expense, going up per year at least, because this just goes up. So if you haven't figured that out, or you need help figuring it out, I'll be very happy to chat with you on it, because I think it is that important. It is that critical. What can cause your health budget to change? Well, higher insurance premiums, certainly a change in your health status. And I'll tell you, please, I've had several situations over the last 60 days where people's health has changed drastically, not COVID related, okay, not COVID related. I have one gentleman who came in, he did a long-term care policy with us in Memorial Day weekend. I'll never forget it, because we were talking about, the barbecues that we're going to have in the yard and not do anything else. And I got a call from him 2 weeks before Thanksgiving, and he had stage 4 pancreatic cancer. Totally healthy in May, stage 4 pancreatic cancer in November. His long-term care policy, 24-hour care, began on February 8th, just this month. So, healthcare can change very quickly, and I've seen it occur more times than I care to share, but I share them because I want people to know this is real. And I see births too. I see weddings. You see good things as a planner too. But you have to plan for all, and you have to be ready for all. So, but certainly a change in health status, and boy, we have seen them. There are various estimates out there. Fidelity has thrown together, and incidentally, that almost $300,000 does not include the cost for long-term care. Okay, so. And again, I do put a chart here for long-term care, but we do a whole presentation on long-term care because of demand. People wanted to hear, tell me more about long-term care. I got to get educated on it. Be happy to do it. But again, do not rely on your Medicare for long-term care, because as I said before, skilled nursing care only will help you for 100 days. And then after that, you're on your own. So 35% of people over 65 have some type of activity limitation. So, this is one of those things that as you age, the likelihood of needing help goes up. It does not go down. Causes of limitation, I have men, women, certainly you see hypertension and arthritis. Those are two big ones. If you don't need help, well, kind of just wait. The big ones there in the kind of the greenish, you see walking and basically getting in and out of bed in chairs. That's also known as transferring, by the way. If you look at those 6 things I have listed there, they're listed there for a reason, because those are known as the activities of daily living, or ADLs. If you can't perform 2 of those 6 that I have there, that's when a long-term care policy would begin to pay out its benefit. Or you're like, you may have an issue like my father-in-law had of dementia. He could do all 6 of these. It's just he didn't know where he was. Very, very sad disease, very sad disease. Levels of care. So level 1, I call these neighborly care, preparing food, maybe helping, balance a checkbook for someone. The ADLs I just talked about. This is the custodial care. If you don't have a plan around this, by the way, you actually do. And I'm sorry to say that the plan would be to dedicate all of your assets towards a care event instead of dedicating some of your assets towards a care event. I think this is worthy of discussion, and really needs to be looked at by folks to make sure that their retirement program includes a plan around what they're going to do if a long-term care incident or a long-term care issue hits them. Please take time to think about this and what's going to happen. Okay, so levels of care, the skilled care we talked about, that's 24-hour supervision. Give you an idea of what the costs are of long-term care. I think this one's better. If you want, I have the source there. There's a website called genworth.com/cost of care. Now, this actually is the cost of care in Trenton, New Jersey. It's the closest I could get to Hillsborough. These are what they estimate the cost to be this year. And you see home care services, an aide, versus a homemaker. That's basically $60,000. You're looking at $5,000 per month to pay for an aide to come in the house and help out. If you have to go into a nursing home because you need more care than that, you see the numbers. Semi-private means that you have a roommate. Private means you're all by yourself. I mean, those are just astronomical numbers. So why plan for long-term care? Well, spare your families from performing it. I mean, you want your family member to supervise the care or manage it. You don't want them to do it. You really don't. Avoid having to spend down assets to go onto Medicaid and be able to direct your own care the way you want it. Those are really the big reasons. So, and I elaborate and talk more about long-term care as well. So let's see, you want to make sure that you do have a solid healthcare plan, but that's not the only thing that you want to be thinking through. Okay. But for our Medicare discussion tonight, just 3 reminders. Number 1, you want to enroll on time. And again, you don't enroll on time, you're going to have penalties facing you. Number 2, you want to make sure you understand how that private insurance works with long-term care, with Medicare. And the private insurance are in 3 areas, okay? It's prescription drug coverage, it's Part C or Medicare Advantage coverage, and then your supplemental plans, okay? You want to make sure you shop for those because that could really change your budget in a good way or a bad way. And then lastly, your need to care for higher healthcare costs in retirement. Roughly speaking, the cost of healthcare is going up, and depending which periodical you read, between 4 and 5.5% per year. The consumer price index is going up between 2.8 and 3% per year, just to give you an idea. So healthcare costs are going up, a lot more than what the consumer price index is going up. So with that said, does anyone have any additional questions for me? We will open it up now to have questions from anyone who has one. And certainly if you don't feel comfortable asking a question in this environment,